Lisa Frost Ramsey is an air quality specialist at SLR Consulting and associate professor at the University of Kwazulu Natal. She talks about the impact of air pollution on our health and steps to improve Africa's health quality.
Probably the best way to define bad air quality or poor air quality would be to look at the concentration of toxic air pollutants in the air. And these can include particulates, so solid particles, and gaseous compounds. And there's various health guidelines that are relevant. And if the concentration in the air goes above those guidelines, they can impact health. On the African continent, a key air quality issue is around indoor air quality, and a large number of households are burning indoors or are using stoves like paraffin stoves that do emit a lot of pollution. Houses are often poorly built, poor ventilation, and the pollution accumulates indoors. People sleep close to these sources of air pollution as well. Air pollution has very high impact on health. In fact, there's higher death rates related to air pollution than HIV and malaria combined. The most vulnerable are children and the elderly. The elderly because their systems are starting to degenerate and they cannot process toxins as well as young people. And children because their respiratory rates are very high. They breathe faster and more often than adults. And their bodies are small, so for the amount of toxins that they absorb, there's a greater effect. So children are very sensitive. Some of the key options would include developing air pollution control law, which is very necessary. And in some countries we have law, but it's very poorly implemented. We need to establish what pollution people are being exposed to. So getting some monitoring networks. There's wonderful technologies coming out of India, for example, that are low-cost sensors that you can put out. You can measure air pollution and you know what people then are being exposed to. You can't address a problem if you don't understand the problem first. Sometimes we're fortunate and you can see the air pollution. So, for example, with smoke and very dusty sources like in mining areas, you can actually see the hazy or the dustiness in the air and you know that you're being exposed. But some of the most toxic pollutants you can't see, and many of them you can't even smell, unfortunately. Also, it's quite difficult to say that if you're sneezing a lot, it's definitely air pollution because it could also be an allergy. So when we're trying to link air pollution to health impact, we not only look at symptoms, such as sneezing or coughing or feeling nauseous or having headaches, we link that with exposure, which would be a measurement of air pollution in the air.